Greetings. In this segment, we're going to welcome Dr. Addie Weaver, a faculty member in the School of Social Work and co-director of the Treatment, Innovation, and Dissemination Lab, a lab that focuses on innovative solutions to address issues of mental health. Welcome, Addie. Thank you for being here with us today.
Thanks for inviting me to talk with you, Katie.
Great. So I thought that it would be great to have you tell us a little bit about how you got started in the work around mental health, a little bit about your background, and a little bit about what the work that you do in the Title Lab.
Sure. So as you know, and I'm sure we'll talk about a little bit more later, my passion for this topic has been my experience growing up in a rural area in Pennsylvania that really had very limited mental health resources and services available. And so I saw that through firsthand experiences trying to access specialty care with family and friends or otherwise, and then through my practice experience working in legal service settings and domestic violence shelters, it became just so apparent when trying to refer clients for needed mental health services that there were tremendous barriers associated with just a sheer lack of providers in the rural context, access issues related to cost, insurance status, and travel burden as well, given that oftentimes in rural settings, folks have to travel quite far distances and there aren't public transportation infrastructures, so a myriad of conditions coming together to exacerbate these access disparities that we see. And those experiences really connected with me, and I wanted to do something about that. And so that really led me to social work, getting my MSW and PhD and focusing in on trying to close that gap that we see. I'm really excited about the Treatment, Innovation, and Dissemination Lab here at the University of Michigan School of Social Work. We're really one of few schools of social work in the country that have a core of faculty members that are really committed to conducting mental health intervention and services research aimed at reducing access disparities, so improving access to mental health treatment for underserved and underrepresented groups and communities. We have a focus on utilizing technology as well as building community capacity within existing strengths to help close that gap, and also looking at not only symptom improvements but also functional improvements for individuals with mental health needs.
That sounds great, and we'll look forward to talking a little bit more about your own research in a few minutes. Before we get into your own research, I'm wondering, and you've already talked a little bit about the issue related to access, but I'm wondering if you could help the viewers understand kind of some of the larger societal issues that you see in your work in mental health.
Sure. So again, I can speak in somewhat general terms, but more specific to the rural context. And so some of what I see as the most critical access issues are just around the sheer lack of providers, particularly in the rural setting. We know that there are some expected shortages overall in terms of having enough qualified mental health professionals to meet needs, but in the rural setting, we're consistently seeing over the last 4 to 5 decades substantial shortages. And when I say that, I mean, like over half of rural counties in America don't have a practicing clinical social worker, licensed psychologist, or psychiatrist. So that's quite significant and really difficult to overcome. While there have been some policy initiatives that have been aimed at incentivizing qualified clinicians to practice in rural areas, they're usually time limited. So folks will come into the rural communities for a short duration, provide service, and then at the end of their contract, and when their incentive is awarded, they leave. There's limited collegial support in those areas, and so, for example, 80 to 90% of licensed clinical social workers are practicing exclusively in metropolitan areas.
Wow. So let's jump into your own research, because I know some of the work that you're doing is really aimed at rethinking or coming up with innovative solutions to address issues of access. So I wonder if you could tell us a little bit about your research work.
Yeah, thank you. I'm really excited about my current research project. I've actually been working in collaboration with community partners in Hillsdale, Michigan for the last couple of years, and we've really been thinking about how to address a community need, which is to improve access to evidence-based treatment for depression in this community in a way that's accessible and acceptable for folks in need of treatment. And what we've been working on is a way to capitalize on existing treatment preferences, which in this community and many rural communities is through more informal networks of care. Specifically, the church setting seems to be a really promising location. A lot of folks in general in the United States, but specifically in the rural community, feel much more comfortable going to clergy when they are experiencing psychiatric distress than going to a local mental health provider. It's less stigmatizing and again, more in line with treatment preferences. And so I began working with clergy, folks from the community mental health clinic in Hillsdale, and talking to potential end users about, well, is this really feasible? What could this look like? And it's really exciting. We're now in the process of developing or adapting group CBT for depression that will be delivered via a computer-assisted platform in rural churches in Hillsdale.
That's really exciting.
Thanks.
To hear and to kind of see how that can be adapted then for other communities as well.
Yes, definitely.
So thinking about your own work and this particular project and some of your past work, what do you see as some of the larger policy implications that people who are thinking about social welfare policy related to mental health, ought to be considering?
Sure, that's a great question. One thing that's been on my mind recently is the increased use of telemedicine, telepsychiatry, to address mental health needs, especially in low-resource settings, and what kind of policy issues arise with that. For example, as a practicing social worker, we've seen that the new code of ethics that came out in early 2018, or the updated code of ethics, has a lot more standards around the use of technology with our practice. And so I think, when we're thinking about using telemedicine or telepsychiatry, we're practicing across state lines sometimes. So there's a lot of other policy considerations that maybe are not completely fleshed out yet in terms of what that's going to look like and how that's going to impact practice and otherwise. Another area where I think there's some interesting policy implications or a need for more focus from policymakers is utilizing community health workers to help address mental health needs. And I don't think we've done too much to think about policy implications in that regard, but I think it's a really innovative, promising strategy to help increase access, again, particularly with underserved and underrepresented groups, and it's going to be, an exciting focus moving forward.
Yeah, definitely. Could you give an example of what a community health worker, what that model might look like, either in a community you've worked with or just generally to kind of help the viewers visualize what that might be?
Sure. So in general, when we're talking about community health workers, we're talking about identifying folks from within that community that share the lived experiences of folks that are in need of care. It doesn't necessarily have to be that the community health workers have experienced mental health needs themselves, but they have the shared understanding of what it's like to be a member of that community. And so the community health workers are then trained, typically by qualified mental health professionals, to deliver support and an intervention to folks with mental health needs. Sometimes there will be partnerships between sort of more formal clinicians and the community health workers. Sometimes the intervention will be a community health worker led alone. And there's some initial studies that show that this is a promising model.
Great, thank you for that. So just thinking about kind of bringing it back to the level of policy, when you think about kind of mental health policy, I know that this is a big question, but what would you, from your perspective, advise in terms of who needs to be consulted as we think about kind of the future of mental health policy in the United States?
I think that's a really important question because with all policy, we often have a small group of folks that have power and privilege that are making decisions and influencing policy that impacts all of us on a daily basis. And so for me, across the board, and particularly with mental health policy, I think we really need the voice of people impacted by the policy. So for me, community members and folks who have experienced mental health needs firsthand, really getting input from them when we're thinking about creating policy around mental health issues is imperative. And we do have some nice models for that. NAMI, the National Alliance for Mental Illness, has been really instrumental in getting consumer voices and family voices to the table with policymakers and around these important decision-making points. And so I think, more of that is very needed and important.
Great. And last question. So many of the people who are going to be watching this video are either studying social work or thinking about going into social work and social welfare policy. And I'm just wondering from your background and your experience and as a researcher and working in the community, what advice you might give to those people watching in terms of thinking if they want to understand more about this issue and or work in this issue in someday.
Sure. I think my piece of advice would be to really understand and appreciate the link between practice, policy, and research. So when we think about, mental health, particularly from the social work perspective, a lot of us are coming into the field because we want to directly serve individuals. And, sometimes that might be individuals with mental health needs. It might be children and youth. We have a lot of different population areas of focus. But really, if we're thinking about providing direct service to individuals with mental health needs, it's really important to understand the policy landscape and how policies are impacting the services that we're able to provide, the services that our clients are able to access, and then also link that to the research. So how are we able to select what the best practices are, how we can best serve our clients, and really trying to make sure that there's triangulation across all of those so that research is informing our practice and moving policy as we find that there's a need to make adjustments or provide care in maybe different ways or different types of care. So I would just say really be mindful and think about those linkages moving forward.
Great. Well, thank you so much for joining us and for sharing all this incredible information. And thank you all for watching.